I'm delighted to introduce to you a lady that I met in Arizona at the first International Fibromyalgia Symposium 2 summers ago?
That's longer ago than that.
3 summers ago.
I think
2004 in August. And she had a large number of people came with just desperate with fibromyalgia, and she was working with them on mapping and all kinds of things that she'll probably tell you about. But fascinating learning for me, and amazing the things that she was able to work with them on. And I'd like you to welcome Claudia Merrick.
Okay, my first announcement has to do with my sunglasses. I'm not a movie star and I don't have a weird eye infection. I lost my glasses the first day I stepped in. Between the rental car and the hotel, I lost my glasses. So all I have is prescription sunglasses. That's why I'm wearing sunglasses. I have fibromyalgia. I am recovered using a protocol that I'll talk a little bit about today. If you see me limping around the hotel or having trouble getting up, it's because I fell off a ladder 2 summers ago, broke both my legs, shattered both my feet, I should say. So it's not fibromyalgia. My fibromyalgia is better, but you will see me limping around. I have a lot of material to cover. My biggest challenge for this today was to get it into a format that would get you the information that will help you and work with the information I have so you can help me. So we're going to go kind of quickly through the slides. There are handouts. There's a lot of information on my website if you need more. This is my self-portrait. Well, it's not my self-portrait. This is a portrait of me up here. This is a typical person with fibromyalgia. And you notice all sorts of the crazy symptoms in every part of the body. What does fibromyalgia mean? It's not a very good name, actually, but fibro means muscles and fibers, and myalgia means pain. One of the interesting things about fibromyalgia and some of the other pain syndromes is that actually the medical dictionary definition of pain is it's an unpleasant sensation caused by tissue damage. Now, in fibromyalgia, unlike burn victims, there is no tissue damage. So, in fact, what people are feeling is not pain by the classic definition, which may be one of the reasons that medications are so ineffective with fibromyalgia and the other pain syndromes. Fibromyalgia is a syndrome. I've said that word about 4 times now. A syndrome just means that it's a collection of symptoms. We have irritable bowel syndrome, bladder syndrome, and what it is it's a group of people that have more or less the same symptoms and no other problem that relates to the symptoms. In other words, if you have a broken arm, that's what's causing your pain. You don't have a pain syndrome. Go ahead. Fibromyalgia actually encompasses a number of other syndromes. Chronic pain, chronic fatigue. Fatigue is a symptom of fibromyalgia. Myofascial pain syndrome. Myofascia is a deeper kind of a fiber that holds the internal organs in the body. That's affected in fibromyalgia. Vulvar pain syndrome, which we'll talk a little bit about in a few minutes. And chronic candidiasis is also actually part of fibromyalgia. These are the most common symptoms of fibromyalgia. If I were going to recite them all, we wouldn't have time to do anything else. But basically what you see is that it's all over pain, fatigue, but things like depression, restless legs, congestion, allergies, stiffness, bad nails and hair. So you can actually see that every symptom in the body is affected. And so the simplistic definitions of fibromyalgia that you get, that it's psychological or it's caused by too much awareness of pain, really doesn't explain the other symptoms, and that's really important to know. The official criteria for fibromyalgia. How is fibromyalgia diagnosed if you think that you know someone who has all these crazy symptoms? The first thing they do is go to the doctor, and he uses this American College of Rheumatology criteria. He looks at 18 places in your body, the person's body actually, to see whether they feel excruciating pain when you press on it. I mean, obviously, if you press on anybody, they're going to feel a certain amount of pain. But this is unreasonable amount of pain for the pressure that's applied. The pain has to have lasted longer than 3 months, or it's not considered chronic pain. It has to be in all 4 quadrants of the body. There are other pain syndromes that are only certain one areas of the body or one quadrant, but fibromyalgia is all over the body. It has to be present in all parts of it. All your blood tests have to be normal. If your blood tests are not normal, then there's something else wrong with you. It could be another kind of arthritis or hepatitis or anemia or something like that. Essentially, you must be tired to have fibromyalgia. Not everyone has completely deadening, incapacitating pain, but you have to have some degree of pain, and you have to have an assortment of the symptoms we just looked at the other page. Not everyone has the same ones, but you have to have a collection of those. These are the 11 out of 18 tender points. Men are affected with fibromyalgia too. Normally in the drawings you see women, but about 20% of patients are men. Go ahead. One of the primary things that people think when they think about fibromyalgia, and doctors too, is that things that shouldn't hurt. Now, there's a lot of conflict about whether this is psychological and people are fearful, or if their bodies develop a chemical problem because of having pain for so long. And some of the things that shouldn't hurt do hurt, and whether that's a question of improper pain processing or something deeper, no one really knows. But you'll hear a lot about this, that fibromyalgics are oversensitive to pain that shouldn't normally hurt. Go ahead. Most physicians, and this is really the crux of the problem and why the EMU organization is involved to some extent, most physicians are not comfortable with fibromyalgia. And I actually stole this slide from Dr. Don Goldenberg, who's one of the top experts in the country on fibromyalgia. I like to steal slides, as you'll see in the coming slides. But most doctors are not really trained to deal with pain medication on a chronic basis. They'll give you something if you're hurt, but month and year of pain medications for something that they can't really define. Most doctors are not really comfortable or trained in that concept. They're also not psychiatrists, and they're worried that patients have emotional issues. Their spouse is enabling their illness, they're malingering, they want disability, and they're not sure how to sort that out. So over time, that becomes an issue. Patients don't respond to treatments. As you'll see when we get into the medications, a good response to a fibromyalgia medication is 20 to 30% of patients having some response to it. So you can try a lot of treatments on patients and nothing seems to help. That's very frustrating. It doesn't fall into a category as far as doctors are concerned. Rheumatologists, it's not a rheumatology condition. It's not an immune condition. It's sort of somewhere in between the both of them. Doctors feel like they don't make a difference. They're spinning their wheels. They're not really helping people. They're spending a lot of time with them. That's a really difficult issue. And again, patients have secondary gain. A lot of patients are looking for disability, are looking for notes to their employers, school modifications, and doctors get bogged down in that paperwork. And for a medical office to try and handle all those things becomes a big issue because you're not paid for it. So those are some of the reasons why doctors really have a problem and are not comfortable treating fibromyalgia. What happens is the patients are left going to support groups. They end up logging onto the internet or trying to find other people, but they also become subject to miracle cures. There's always somebody out there selling something, and because doctors are not sure that they have a good answer, patients become vulnerable to that. And one of the things that patients encounter and absorb from the internet and books is that they are doing something wrong. Either they've eaten the wrong things, they've been exposed to the wrong chemicals, they have some kind of deficiency, and they can make that better by using something. And this idea is enforced by supplement marketing, and pharmacists. A lot of pharmacists will sell patients supplements because of the medical insurance system. They get $3 when they sell a prescription drug if you have insurance, but if they're able to sell you an enzyme, they can make $50 on the bottle. So there's a lot of profit in it for people other than the companies that manufacture them. So the distribution of information when it comes to something like fibromyalgia, because most patients can't really read medical papers, and the medical papers are all about microscopic intracellular findings that don't help you manage your condition, most people go, this is where they get their information. And this is how, if you have a product for fibromyalgics, you would bring it to the fibromyalgia community. You would go through support groups, I have an in-person support group that meets every month. Most groups do something like that. There are newsletters. I have a newsletter. My subscription, I have only about 1,000 subscribers, but there are e-subscriptions that are higher. Mine's a print one. Websites, we have a website, fibromyalgiatreatment.com. Through websites and through the websites for the various conditions and the clusters of symptoms, such as skin problems, seminars and symposiums like this one, and like the fibromyalgia seminars and symposiums, which is how I met Clover, who came to me through patients who had tried EMU oil, and they brought it to my attention. Advice from individuals. A lot of people know people with fibromyalgia or know people with problems. Information gets out that way. And people actually bring these things to their doctors. They walk into the doctor's office and they say, I found this EMU oil. Can it hurt me? Can it interfere with my medications? So actually what you're seeing is instead of doctors giving patients products, patients are bringing products to the doctors, and when they see a positive response, those doctors will use the products on other patients because they really don't have a lot to offer. You also see a lot of treatment by non-physicians, and that would be things like chiropractors, massage therapists, nutritionists, and so on. It's not just doctors. Okay. I limited this talk to basically 2 clusters of symptoms that relate the most closely to EMU oil. And those are the skin symptoms, and if you have EMU oil or you market it, you know that these are all things that EMU oil helps on, which are the dermatitis, eczema, itching. About 70% of patients with fibromyalgia have severe itching, with or without something you can see on the skin. Paresthesias, which are abnormal sensations like burning, stinging, knives, anything that doesn't belong there. Pimples, acne, and rosacea, you know all about. In fibromyalgia, the body's secretions are excessively acidy. There are some reasons for it we'll get into, but that perspiration can irritate the skin and cause some of these rashes. I used to think I was allergic to my own perspiration, and EMU oil can protect your skin against the perspiration and those acidy secretions, and those cause a chemical burn. Sometimes in your sensitive skin you can actually see like a red burn that looks like something was caused by chemicals. Brittle nails, dry thin hair, poor quality hair, hair loss are all symptoms of fibromyalgia too. The treatments that doctors have to offer if you go into your doctor's office are those that are up there. They're basically medications, antihistamines, steroids. The problems with all of them are right up there next to it. Antidepressants obviously have a lot more side effects than that. The antifungals that a lot of people want to take can cause liver damage. Things for itching and so on can cause fatigue. So a lot of patients look at this artillery here and say no thanks and go back to the internet. Go ahead. And that's where your support group-driven therapies come in. If you go to a fibromyalgia website, this is what they'll tell you to do. Avoid certain chemicals, use heat and cold therapy. EMU oil is a wonderful thing. Some of the over-the-counter creams, although many of them have cautions over time, make changes in your diet and simplify the products that you use internally and externally. So this is a lot more comfortable advice than what the doctors have to offer, and this is why patients are going where they're going for information. The next syndrome, which I'm here also to talk about, is the genitourinary syndrome, which are both the urinary and the vaginal symptoms. A lot of times, honestly, patients can't tell what's burning. They just know there's burning or itching and uncomfortable symptoms, and they can't separate the two, but they actually are 2 categories. And one is in the urinary tract, which would be painful urination. These are the patients that urinate all the time. They have bladder infections, a condition called interstitial cystitis, spasms in the bladder. They get up all night to urinate. When they urinate, it burns. The vaginal symptoms are very similar, except they occur around the external female genitalia area. They're vulvitis, which is just inflammation of the vulva, vaginal spasms, painful intercourse, dyspareunia, which is painful intercourse, yeast infections, symptoms like yeast infections, which are not yeast infections. A lot of patients think they have chronic yeast infections when it isn't yeast at all, and then itching also. 66, the most important thing on this slide is 66% of female patients have these symptoms. These are the vulvar pain symptoms. They're the knife-like burning pain, itching with or without pain, painful intercourse, the skin changes around the area. And this last one I also stole off a doctor's slide. I like the hypervigilance when it comes to pain. In other words, what they're saying is these patients are, because they've had pain so long, are afraid of causing pain, which is causing pain. This one I also stole. This was from a medical presentation about how to diagnose vulvodynia, and you can see how you diagnose this. If they have no explanation for your pain, you have vulvodynia. Similar to if you have no explanation for your other symptoms, you have fibromyalgia. This I also stole. This was to help doctors. These are the treatments. Again, this is what a doctor would offer you, and you can see next to it they have dryness, weight gain, neurological symptoms. The gabapentin on the bottom is an important new one. That's Neurontin. Actually, you're not allowed to drive a car when you take that, and vulvodynia mostly involves younger women of childbearing age, so you can see that that isn't really a very good suggestion. So again, people go back to the internet looking for support groups. Next. And, oh no, I forgot this one, sorry. This is my absolute favorite, and this is what doctors will do if the medications don't work. And this is called surgical management, which means just cut the area off. But the success rate on that, you'll see below, is only 40 to 100%, which is a huge range, and long-term data is lacking. A lot of women have had these surgeries, and in fact, this has done no good. The doctor that I work with, Dr. John Willems, who did the original pioneering work in vulvar vestibulitis, actually discovered the way that estrogen works to help the tissue, and also now EMU oil. They were using it to prepare women for surgery, to make the tissue strong enough to withstand surgery. And he said, well, wait a minute, if we can make the tissue strong enough for surgery, why don't we just keep going and avoid the surgery? But there are still a lot of practitioners that use this technique here. But support groups, on the other hand, will give you these ideas: calcium citrate in divided doses, dietary changes, the topical estrogen, which you know doesn't get into the system as much as oral estrogens, but you do have to be careful over long-term use, and it's something that you want to use as little as possible. Boric acid, which works on yeast infections. Yogurt applications are an old-time favorite. EMU oil now has really taken over the yogurt applications and the other things, because it's proven to be such a big help, both with the swelling, the pain relief, and actually lubricating the area. Because as you'll see, they recommend that you use an oil-based lubricant so that it's not washed away by urinating or wiping and so on. But commercially available lubricants, I put that down there for you. You can see that those ingredients really scare the heck out of most people with vulvodynia, putting those things on that area. Most of them have alcohol or propylene glycol or other irritating ingredients. That makes it very hard to find a product if you have vulvodynia and you need a product to put on your skin. Next. Oh, you can skip over. No, you better do this one. Interstitial cystitis is the same kind of a part of the syndrome. They do tests, and if it shows abnormal white cells, you have interstitial cystitis. If it doesn't show abnormal white cells, but you have the symptoms, you still have interstitial cystitis. And the tests are kind of painful, by the way, too. They have to do biopsies. So the absence of positive tests for other findings. If there's nothing else wrong with your bladder and they can't see anything, you have interstitial cystitis. The symptoms again make the diagnosis. And these are the symptoms. I went over them a little bit. There's also diffuse pelvic pain, multiple bladder infections, and now the name irritable bladder, which is sort of the patient name of it, is taken over because of the Gotta Go commercials that everyone is now seeing. And you can take the little irritable bladder quiz in People magazine and find out whether you have this. So it's now more or less called irritable bladder. Again, these are the treatments that doctors will offer you. Analgesics, bladder installations, again, 50% of people after 6 installations, and this is putting it directly into your bladder, have some improvement. And Elmeron, which is the only drug that's actually, well, was the only drug approved for irritable bladder, it takes 3 to 6 months to work, and those are the side effects. So again, these are not very appetizing choices. So patients move on, and they go to their support groups, and this is what they're offered by support groups. Dietary changes away from the acidy foods. Preleaf is a calcium supplement that blocks some of the acid in your foods. It works the similar way Beano works on gas. EMU oil capsules and topical EMU oil have been a lot of help because the urine is very pungent and actually burns on the way out, actually burns the skin, so you need to protect the skin. A lot of women do things like not using toilet paper, but using a spray solution and so on, because the skin is so sensitive and needs to be protected, and EMU really helps with that. MSM is a newer thing, heat and cold, and then biofeedback techniques. So again, those are a lot more appetizing than what doctors would offer you. These are some of the medications that are used in fibromyalgia commonly. This is the first-line therapy for doctors right now, are the pain medications. They move on to stronger ones. The anti-inflammatories, there's no inflammation in fibromyalgia, but they do have some pain-relieving effects. The anti-seizure drugs are real popular right now. Neurontin. The last one, which is pregabalin, is the first drug that was ever approved for fibromyalgia. So that's now, a lot of fibromyalgia are being prescribed that. Migraine medications, trigger point injections, antidepressants, muscle relaxants, you name it, they prescribe it for one of the symptoms of fibromyalgia. These are, when you look at the actual evidence for medications in fibromyalgia, what you find out is there isn't any. There's no data that is at all impressive. There's some strong evidence that the older antidepressants and Flexeril work on the symptoms. Those are the ones that cause weight gain, dry mouth, lower your sex drive, hair loss. Those are the ones with the, unfortunately, with the most side effects. Tramadol, they've done some studies on, modest pain relief, and the newer antidepressants like Zoloft. There's no evidence on the newest class, which are serotonin and norepinephrine reuptake inhibitors. Pregabalin, which is the new drug. Here's the key to this one. 27% of patients had up to 50% improvement. That is dismal, but it shows you how desperate the people are looking for a medication for fibromyalgia. It actually now is approved for fibromyalgia. Doctors are now handing it out. If you go on the internet, nearly everyone's been offered pregabalin. There's some weak evidence for growth hormone, but growth hormone must be injected. It's expensive. There's no evidence that the strong pain medications work at all, and the benzodiazepine, the tranquilizers and hypnotics, and herbal medications. There's no evidence that hormones such as thyroid hormones, DHEA, cortisol work at all, and there's no evidence that long-term the stimulants work. Next. The majority of drugs that are brought to market are for symptoms that you can control a little bit, don't kill people, and don't actually get cured. This is where the companies are bringing out the most drugs, and unfortunately it means that new therapies aren't being developed because they're expensive and they're difficult with fibromyalgia to get any kind of response on. The woman who made this quote used to be the editor of the New England Journal of Medicine, and if you have interesting reading to see how drugs are brought to market, how they're patented, what possibilities you have to get things approved or recommended, this is an excellent resource. One of the big problems with oral medications is the cytochrome system. Cytochromes are enzymes in your liver, lung, intestine, and kidney, mostly in the intestinal tract, that are basically designed to destroy everything that you put into your body that they're not sure about. And that can be everything from hormones like estrogen to foods like grapefruit juice and good medications. The problem is that when you use one medication, it can kick up the cytochrome system. 2 can do worse, 3 can do more. No, it's just a crazy thing and no one knows what's going on. And that is one of the reasons why most drugs you'll find are effective in only 25 to 60% of patients. Sometimes the effects, for example, with the antidepressants, several weeks after you stop taking that medication, it's still working on the cytochrome system. So it makes it very difficult to work with medications, and especially these multiple medications you see in fibromyalgia. Next. So I got this, and I thought this was interesting for you. They are now looking for testing of compounds that can be applied topically because they bypass, by and large, the cytochrome system. So if you can use EMU oil as an anti-inflammatory instead of taking an Advil, medically or pharmacologically speaking, you're much better off. So they're looking for things like the estrogens and the compounds that can be applied to your skin. And at the same time, we have to be wary about what we're putting on our body, especially fibromyalgics. This came off the Safe Cosmetics website. Basically, we're all exposed to thousands of chemicals a day just in the course of the few products that we use. Next. Safecosmetics.org. If you go there and you market products, you can sign up. EMU oil is considered low risk, and there are some products on there with EMU oil in them. Major companies are avoiding this website and this issue like the plague because most of their ingredients don't pass muster. Next. And the concerns also, this is not just chemicals. I want to make that clear, just like the fellow did in the organic symposium speech yesterday. A lot of them are plant compounds that are just as dangerous. You can't have arsenic around organically grown things. They contain many chemicals. Soy and other plants are sources of estrogen. If you've had cancer, you don't want to take herbs. If you have other medical conditions, you have to be very careful about the many chemicals in plants. Once you put a plant oil in something, you have to put preservatives in it. And they have to be strong preservatives because, you know, things go bad. You can't put cucumber in something and expect it to have a shelf life of 3 years if you haven't put something in there to maintain that potency. And some plants are very irritating to the skin. I was in the pharmacy, the department store, and someone wanted to put a thing on my lips that were going to make them poof up like a movie star. And I was suddenly terrified about what would make my lips poof up that I would want to put on it. But there was a woman next to me, and she was just thrilled, and she told me how good it tasted. So, you know, people do worry about that now. Prescribed topical medications never contain plants. If you go to your doctor for a cortisone cream or an antifungal cream, they don't contain plants, and those are some of the reasons why. Next. Fibromyalgia patients have been told they have sensitivities. They are hypersensitive. They do have more allergies. The immune system is somehow involved in fibromyalgia. It's depressed and it's overactive at the same time. The genetic work that my foundation is doing at the City of Hope right now is focusing on the genes and a blood test that finds that area. And using the least number of ingredients and products minimize your possibility of problems with sensitivities. Fragrances, especially for fibromyalgics, and a lot of ingredients have fragrances. Bad. Next. This I pulled off drugstore.com. I thought you'd enjoy this one. This is a hypoallergenic moisturizer. Again, if you have any kind of skin issues, look at the number of ingredients there. There are your preservatives, there are your colors, your fragrance, your parabens, and plants, and so on. And then next to it, I put EMU oil, and you can see why people are gravitating to EMU oil who have sensitivities. Now we're going to get into a little bit about fibromyalgia and the treatment that the doctor I work for uses. This is absolutely immaterial to you. What's just showing you that all sorts of crazy things are going wrong in the body. All sorts of blood tests are off, but they're still within the normal range. They're just a little bit higher than normal, a little bit lower than normal. None of them are diagnostic. So when all is done, what do we know about fibromyalgia? We know that whatever's causing it doesn't show up on any blood tests. There's no antibodies. So it's something that belongs in the body. It's probably just in the wrong place. We know that all patients are fatigued. We know they have sensitivities. We know every system in their body is off and not working right. That's what patients will tell you. Nothing seems to work right. And then you can find these areas of swelling on everybody's body. Some of them hurt more than others, but everyone has contracted cells in a predictable pattern, which were those tender points that you saw on the first slide. So this is all that we really know. And as you can see, most of it is what patients tell doctors or researchers. Next. So based on this, what might cause fibromyalgia? Well, the theory that the basic theory, everyone agrees now that it's genetic, and we don't know what genes are involved, but it's probably something being retained in the body, very similar to gout, but gout attacks only joints and only certain joints, and mostly men, and fibromyalgia is mostly women. So it's not the same chemical, which are urates, it's something else. More areas are involved. It has to be something that's more common in the body. So the candidate is inorganic phosphate. Because it's the logical it's involved in energy formation, and so it's logical that if you don't have energy, something is mucking up the work. The only thing that can cause tissue to contract, like you see in fibromyalgia, those areas of spasm, is calcium in the wrong place in a cell. So you have to find a culprit that can cause that. Next. The doctor I work for, Dr. St. Amand, started working with guaifenesin. Originally, he used gout drugs. They worked in high doses. Guaifenesin, which also lowers uric acid, but not significantly, he decided to use for that reason. It was much more effective in patients than the gout medications. The original compound is a bark. It was been used in cough medicines and so on. Bark was actually used for rheumatism and arthritis many years ago. It then was used in cough medications to suppress, to liquefy mucus, sorry. It was synthesized 30 years ago. The guaifenesin that you take now and you see in your cough medicines is no longer a bark. It is the same chemical that is in bark. It is not a bark. It has some actions on the body that have never been studied because it's an older drug. It's like aspirin. It's like ibuprofen. They do many things. There's no money in exploring what they do. The interesting one here is that serotonin is involved somehow in fibromyalgia, and this increases the metabolite, which is found in the urine, of the precursor to serotonin. It was first used in 1995. It is now over the counter. That is good news and bad news. It means everybody can get it, but the bad news is that no drug company is going to invest in exploring it. Similar to the problem you have with EMU oil, you can't patent it. Before they'll make a medication out of EMU oil, they'll discover an active compound in it that they can patent instead of using the EMU oil, because they can't make any money off something everybody can sell. Guaifenesin actually pulls out the phosphates that are stored in the wrong places in the cell. This is just a slide that explains what happens under treatment. Because it's a deposition disease, it slowly gets worse over time. The symptoms start out now and then. You become more and more constant until eventually you have symptoms all the time. When you start the guaifenesin, then you reverse back through your own disease. So wherever you start that, if you started at 80, if you started at 60, if you started at 10, you reverse back through your own disease. This is a body map, and what this is a practitioner has examined the patient and written down on this chart every area that he or she can feel that is contracted and doesn't belong there. You wouldn't find those areas in normal patients unless they had an injury, and again, that would only be in one area. So this is the beginning before they start the guaifenesin, and the next slide shows you what happens after a month on the guaifenesin. The areas slowly start to pull out. There is pain when they come out. There is reproduction of symptoms. You do feel worse during the cycles where it comes out, but eventually you do pull out all the deposition. Guaifenesin, we titrate the dose. Some patients use between 600 milligrams and 2,400 milligrams a day. You don't need to know this, but basically there are different doses of guaifenesin. One of the problems with guaifenesin and the gout drugs that can't be readily solved is that they are blocked by salicylates. You can't take aspirin with probenecid or the gout medications. You can't take it with guaifenesin. But there are more salicylates than just aspirin. Pepto-Bismol, for example, is bismuth subsalicylate. So the guaifenesin will not work at all if you take a medication that is a salicylate. But unfortunately, because plants are the source of natural salicylates, all plants make it. It's the immune system in plants. Willow bark, of course, was the original, salix was the original source of salicylate. Herbal medications, concentrated plants will also block the medication. So our patients cannot take herbal medications, and they can't use plant oils or extracts on the skin for the same reason they're absorbed directly into the bloodstream. Topical menthol as a pain reliever, mint and toothpaste will also block the patients. So this is what they can't use. As you can see, they're all the sources of salicylic acid. They include things like sunscreens, body powders, mouthwashes, dental products. So the guaifenesin patients have to find solutions that don't contain the natural plants or salicylic acid of any kind. Next. These are some of the salicylate-free products. As you can see, any of the medications that are not salicylates, there's heaps of them. Vitamins and minerals, as long as they don't have added herbs, are fine. And then topically, anything that's not a plant oil or extract. And that's one of the reasons why you see so many of our patients using EMU oil, is that it's one of the things that won't block guaifenesin. I left this up here because I thought it was somehow applies to what you're doing too, and that is that what can you do when you have an illness or you have something to market that doesn't fit into the way things work. You empower yourself with solutions, you make support groups. This is really a support group here. To me, medically speaking, you're supporting each other, you're teaching each other, you're giving out information the same way that my support groups do for illness, only yours is not illness. But, and it reminds you, and you need to remind each other what you can achieve. And I've seen a lot of this, and I've been really impressed by this, which is not allowing people to fail. I asked Myra last night, how do I send people to find EMU oil? I don't want to pick out, I don't know who to send them to or what to do. And apparently you can do it through the EMU Association, and that's really wonderful. And that's what we try to do with fibromyalgia, and there are other organizations that do the same thing. Make good friendships and give back to your community. You're all doing that, and I think that that's why I left it up there. Okay, next. This is my organization, the Fibromyalgia Treatment Center. My husband passed out cards. That's our website. The information on guaifenesin, salicylates, and all the symptoms is up there. If you haven't seen them, and they're available in bookstores and so on. This is the book I wrote with the doctor I work for. This is my book. These are basically books to help to get the information out to patients because there wasn't any other way to do it, the way things are set up. We're looking to do research right now, same way you are. We have some studies under control, that are being worked on, sorry. Hopefully to get the information out there about what causes fibromyalgia, how to treat it, how to help people with it, but it's all grassroots. And so we're coming at the medical profession sort of backwards, but I think the way the cards are stacked, that's the future of chronic illnesses, and that's the future of treatments that work that no one individual can benefit from. So, does anybody have any questions? That's it. No question? Yes?
How about your feelings about what Dr. Lee has written in the hormone information book, the two that he's written?
Well, the hormones are a sticky subject because hormones, as you know, are so powerful. Low thyroid, he basically uses thyroid. Basically, thyroid doesn't resolve all the symptoms of fibromyalgia, obviously. The thyroid he uses, which is an animal thyroid, T3, again, it's a supplement. It's an animal thyroid, it's not what humans make. So our thyroid, which is T4, doesn't give you energy the way the T3 does. It does give patients more energy, but it doesn't solve the metabolic problem or the genetic problem.
Okay, now he suggests the natural progesterone.
Mm-hmm. Yeah, the strange thing about that is that with fibromyalgia, progesterone actually is one of the things that makes people feel worse. Except, well, it's the thing that causes the premenstrual symptoms when you're menstruating. In other words, the bloating, the pain, the headaches, the migraines, and so on. When you're in perimenopause, though, you don't release the progesterone because you're not ovulating. What triggers progesterone release in the body is when you ovulate. So women in that age group, progesterone can help because it actually normalizes the hormones a little bit, but it's limited. Now, the new estrogen studies that they stopped, as you know, the patients who were taking estrogen and progesterone had the highest increase in breast cancer. They did not stop the patients that were taking estrogen alone. They didn't see problems with estrogen alone. They only saw problems with estrogen and progesterone. So that makes a lot of people nervous about progesterone and what it might do. So I'm not sure. That's it? Okay. Thank you.